All right, it's 11:03. We're going to go ahead and get started here. My name is John Lozo. I'm here with Lisa Clemens from Safe Sleep Simulation. We just want to say thank you for joining us. We talk a little bit about some innovative approaches to safe sleep education that we've been using in Northern Indiana. As the innovation team said, feel free to drop any questions that you have in today's Q&A part of Zoom, or post any comments or anything in the chat. So we're going to have, well, we were planning on having two speakers, Erin Norton and Michael Sharp, but unfortunately, Michael Sharp said he's been dealing with a house full of sickness, and we don't think he's going to be able to make it. So we'll just be hearing from Erin Norton, the exciting things that her team's doing in regards to safe sleep, and then Lisa and I will give the story of kind of the journey we've been on with this safe sleep simulation program. All right. So first up, I'd love to introduce Erin Norton. She is a registered nurse, a bachelor's prepared with a MBA, who is currently the director of Parkview Health's Women and Children's Service Lines Community Outreach Program. She's also the Allen County FEMA coordinator. So,
all right, thank you, John, for the nice introduction. I am very grateful to be with you all this morning talking about safe sleep and helping more babies get to that first birthday, something that's near and dear to all of our hearts. My talk this morning, and John, if you want to advance to the first slide, please. I'm really going to focus on the why and the backstory behind the safe sleep simulation. John and Lisa will get into the details and the demonstration, but my piece predates their involvement a little bit with safe sleep here in Allen County. And the key word that keeps coming up when we examine how our safe sleep journey has evolved here is why. So that's going to be my focus today. John, if you would advance again, please. Thank you. So my assumption here this morning is that if you are joining us, it's because you care about babies, you work with families, and safe sleep is an interesting topic for you. My hunch is that many of you work on the front lines or lead organizations of folks who work on the front lines and care about families and safe sleep. And so what we have observed here in Allen County is that cribs are often in homes, but they're not being used. I oversee a team of diverse community health workers who do home visiting, and we see quite frequently, we go into a home and there will be a pack and play, but it'll be filled with stuffed animals and blankets or laundry or toys or other items, and pretty clearly not being utilized. And so that's something that we've seen as I've talked to people from around Indiana and around the country, I don't think we're the only ones. We've also found that caregivers could recall some sleep education, but it wasn't resulting in behavior change. We hear things like, oh yeah, I remember being told about putting my baby on her back. Yeah, but they're just not doing it. And so that could be for a lot of reasons. It could be that we're going against what the family has done for generations. We hear, I slept you, grandma says, I slept you guys on your belly. Your baby will be fine too. We hear that all the time. And then also a lot of women just don't understand why, if the first and perhaps only time you've gotten safe sleep education is after you've just gone through hours of labor and delivery and no sleep, it's hard to remember really anything. And sometimes we go for the path of least resistance, especially if we don't understand why. So again, that word why is coming up again. Understanding why you need to do something is a whole lot different than just being told to do it. We've also found that moms receive education, but moms aren't the only one taking care of babies. Dads, grandmas, siblings, babysitters, childcare providers, All of these people are putting baby down to sleep, but very few of them receive education. And we've also found our team of community health workers will take in, I'm sure many of you have seen it, the NIH illustration of a baby's anatomy. But these illustrations are pretty complex, especially if you don't have a medical background, and especially if you're not familiar with this type of picture. It's pretty difficult. One of our community health workers spoke up herself, and after learning about or hearing, seeing the safe sleep simulation demonstration, she said that's when it really clicked for her. Even though she'd seen the picture and had even been able to explain the picture, it was still kind of fuzzy in her mind because it is just such a complex illustration. So if you'll advance one more, please. So I just want to give you a pretty informal illustration of our journey that we've been through so far, and it is ongoing, and we certainly aren't at the end yet. But the first thing that we did was, and this is me, this is prior to connecting with John and Lisa, so we partnered up with someone who had a fresh perspective. I had been overseeing this group of community health workers who had been doing home visiting, who had some concerns. My involvement with FEMR, we knew this was an ongoing problem with deaths related to unsafe sleep, but it just didn't feel like anything new or different or innovative had been happening for years, honestly. There had been a handful, there might be a new handout or something like that, but not anything that was really fresh or new or substantially different from anything we'd done before. And so Lisa Clemens and I met through a series of fortunate events where she as a provider in the emergency department at our hospital, and I who'd worked in women's and children's had never connected before, but she had seen kind of the worst of the worst outcomes when kids were being seen in the ED trying to be revived and everything like that. And I had the other perspective where we were, working with families and trying to figure out how to get this education through in a way that was meaningful. And Lisa also had a connection with John in our simulation lab. And it was really interesting that everything fell the way it did, that we were able to make a connection and really come up with something new and different and creative. So step number one, partner with someone who has a fresh perspective, because let me tell you, if I could have solved this problem on my own, I would have done it a long time ago. But it took a fresh set of eyes and a new way of thinking that I had never considered or encountered. Step number two, listen to people who know what's up. Plain and simple, kudos to John and Lisa throughout this entire process. They have been keyed into the community that is most affected by infant mortality and safe sleep deaths. And for us here in Allen County, that's Southeast Fort Wayne. Our community health workers on my team are a very diverse group who are experts in the communities that they serve, which is primarily Southeast Fort Wayne. We have community health workers who speak Spanish, Burmese, and Thai, as well as English, and also a Karen, a dialect of Burmese. And so they are able to provide information about the community itself and about cultural beliefs that you really just can't get from anywhere else. So kudos to John and Lisa who throughout this whole journey have really listened to the near peers on my team who really understand the needs of the families, and they have incorporated that advice and feedback throughout. Step number three, bring some friends along for the ride. Why? Because again, we can't do this alone. Nobody can. And the more people that we get involved, the better. What we have found is that incorporating the Safe Sleep Simulation Kit, talking about it, getting it out there, has really been a catalyst for change so far in our community. And again, we are in the very, very early steps, but we can see really exciting things on the horizon. One of these things, first of all, is meeting with you today. You are some of our friends that we're bringing along for the ride. We're wanting to connect with you, and if we've got an idea, we certainly want to share it so we can impact as many families as we can across the state, across the nation, across the globe. But this has also been an interesting way to talk to new friends and to make new friends in our community. I had the opportunity previously, a year or so ago, to talk to our mayor about how infant mortality is impacting our community. And the reality is that conversation was pretty gloomy. Even though we had made some improvements, talking about babies dying is just never really a feel-good conversation. And so when John and Lisa had developed the Safe Sleep Simulation Kit, and we had some new ideas, and we were able to go back to the mayor and tell him about this update, it really put a happy spin on it, because now we have a solution. Now we have something that can make a difference. Now we've got something new and innovative in a field where there hadn't been a lot of innovation for years. And even better, the mayor's constituents contributed to the solution. People in Southeast Fort Wayne, their feelings, their ideas, their feedback, all were incorporated into this solution. So it's really been a group effort, an effort that's included a lot of views and perspectives and lenses that we don't always get. And so I'm very, very grateful for that. But in talking to the mayor and coming up with the solution, he's able to make some additional connections for us. We've since talked to the superintendent at Fort Wayne Community Schools, and then more recently, the superintendent at East Allen County Schools, two of the largest school districts in our county, who are excited about using this tool to teach kids who we know are babysitting. In our most recent discussion with East Allen, the superintendent brought up of how many times it's come up with all the virtual learning we've had because of COVID, that young students, middle school age students, are caring for babies while their parents were at work. I'm not saying that's the right thing to do, but it is something that's happening. And we know young kids are taking care of babies. And they're certainly not at prenatal visits. They're not getting this education in the hospital. They don't know. And we have had, unfortunately, deaths occur in our county when a sibling has been the primary caregiver of a baby. So again, this tool has acted as a catalyst to get new things done. We are very excited about it, working with different groups and being able to use the toolkit that is visual, that appeals to different kind of learners, that's something different than a handout or a piece of paper, to get more people involved and to get the conversation reinvigorated. It's something that I think people have heard before, but now we've got, with this toolkit, or with this Safe Sleep Simulation Kit, we have a new perspective, a new thing to talk about, to get excited about, and it's really just reinvigorated these conversations in a way that has both surprised and delighted me. And I'm very excited to see what is to come. So if you'll go to next slide, please. Because step number 4, what we're going to do is we're going to celebrate more first birthdays. And once again, getting back to the why, this little girl is my daughter, Iris. She is now 20. So she has had many birthdays since then. She is a college student. She loves to rollerblade. She is a great friend. She is so many wonderful things, and she is contributing to our community, and her life matters. And I'm so glad that she gets to celebrate her first birthday, because what she's going to do in this world is going to be amazing. And our community and my family will be better because of it. And it's not just my baby, that's everybody's baby. Everyone should get to celebrate a first birthday. That's why we're doing this, and that's why it matters. Again, the why. It matters because babies live. It matters because when women have the information that they understand, when families have the information, when all caregivers, that's what's going to contribute to behavior change. And that's what's going to, again, lead to more first birthdays. So thank you for joining us today. And John and Lisa, I'll hand it back to you to get to why you were all really here today to see this new kit. Thank you so much.
Thanks, Erin. We just wanted to remind everybody real quick, if you have any questions, feel free to post them in the chat or the Q&A. We've got one question for you here, Erin, real quick before we get to that though. Would you mind talking a little bit about just kind of the bigger picture, the future of where we hope to be heading here with the Safe Sleep City and maybe the collaborations with Ira Kedley too?
Sure. So the Safe Sleep Simulation Kit has been, like I said, a catalyst into opening up doors that had not been opened before, because we talked about safe sleep is not a new topic, but the kit has given us an opportunity to open new doors. So Ira Kedley works for the mayor. He's a gentleman who focuses his work on African-American men and helping them live life to the fullest and be all that they can be. I certainly can't explain his work as well as he can, but he's very interested in incorporating dads. And now we have this kit that he feels like will really resonate with them. Mayor Henry goes to different conferences for mayors around the country and has extended an invitation in the future that we'll be able to go to some of these other, to these mayors conferences to talk with other mayors, other communities about reinvigorating the safe sleep conversations in their towns, with the schools. We're really being able to open doors that hadn't been open before, or had been, frankly, the safe sleep conversation was kind of feeling like old news. Yeah, we know safe sleep's a thing, and then everybody kind of shrugs their shoulders and doesn't feel like there's anything more we can do that hasn't been tried before. And now we've got something new to try. And so we're very excited about that work and really incorporating into a safe sleep city concept, because it has to extend beyond the individual level intervention, which the kit is the first step on that. But to really make lasting, sustained change in our community, we need to think about what we're doing at a population level, where everybody's just thinking about safe sleep. That's just something we talk about. If you're having a family get together and somebody's bringing a new baby, oh, do you have a pack and play? Because we need to make sure we have a safe sleep environment. That's just something, on Thanksgiving, yeah, we have to have a turkey, we're gonna have mashed potatoes, we got to make sure the baby has a safe sleep environment. That's just a standard, that's part of the discussion. Everybody knows, everybody's talking about it, because here in Fort Wayne, Indiana, we're a safe sleep city, and we can't, every sector is thinking about safe sleep. So again, we are in the baby steps, but we're excited that there's a lot more to come. So, and I see there's another question here. I'm not sure if this is for me. As a lactation consultant and always discussing safe sleep and infant feeding, what kind of messaging do you all give on how to protect and promote breastfeeding while ensure babies sleep safely? Well, that's a question that is near and dear to my heart, because I am also a lactation consultant, and safe sleep and breastfeeding, it's not a one or the other. They can both occur together. We want babies to room share with moms. We want babies to be breastfed. We encourage breastfeeding because breastfeeding mitigates the risk of deaths related of SUID deaths. And so absolutely have your baby close, but just not in bed with you. And safe sleep is hard. Nobody is saying that it isn't, but it's worth it. It is worth it. So I'm not sure if I answered your question, but we absolutely promote breastfeeding and safe sleep at the same time. Both are important. I don't think there are any other questions. Thanks.
Yeah, that seems to be the only one. If anybody else has any, once again, please throw them into the chat. and then we can ask Erin. She'll be around to the end. And speaking of that, I forgot to mention before, we are giving away one Safe Sleep Simulation Toolkit at the end of it. Must be present to win. We'll do a drawing live. So stick around for that piece at the end. So thanks again, Erin. I just love hearing you talk about all the great things that you and your team are doing, and some of all the collaboration with your team members and the development of this kit, but then all of the bigger picture things that have come about, not exactly directly related to this kit, but more just conversations around it and things that have grown from that. We think will really make a difference. So thanks again. We were going to have Lieutenant Michael Sharp from the St. John Fire Department in St. John, Indiana, give a talk, but due to family sickness, we don't think he's going to be able to make it. So just wanted to give him a quick plug right now. We met him several months ago, and he is a firefighter paramedic in the St. John area of Indiana, which is Lake County. It's up towards Chicago, the Indiana side of Chicago. And he is the chair of the Lake County Community Action Team, which is really, in my rather limited experience with community action teams, it's pretty inspiring. They've got buy-in from a lot of different hospitals and organizations, and everybody's on the same page. And he is just one of the most passionate people that we've met about safe sleep, which I feel like is a little atypical, especially for a male healthcare provider. So he's a paramedic firefighter. He does dose training, direct on-scene education. Nutshell version, if they identify unsafe sleep practices when they do EMS calls, they're able to address it. So we hope to get him involved in a future webinar, or we'll send out some follow-up information about ways to get in contact with him if you have any questions about that. But to him, it's all about the babies. That's kind of his earned catchphrase that he's gotten over the years. And he's a great guy. So since Mike won't be able to make it, we'll go ahead and start with the Safe Sleep simulation presentation that Lisa will begin, and then I'll tag along at the end with some of the more technical information on the kit. So I'll just do a quick intro for myself and then turn it over to Lisa. So I work at a Parkview Health System in the Advanced Medical Simulation Lab, where we do a lot of really cool training with these high fidelity mannequins that breathe and blink and bleed, and it's very, very hands-on. We've got virtual reality equipment and task trainers, and really the summary of what we do is an experiential learning. So very hands-on learning concepts, breaking away from the traditional kind of stand and deliver to more of side-by-side, let's learn together learning modality. And there's been research to support that it works well for healthcare providers, and we're trying to apply that to the patients. So I do the simulation full time. I also take care of the 3D printing here within our hospital system, doing things like anatomical models and working on various innovation projects. So I was brought on early and helped with the development and the iterations and production of the Safe Sleep kit that you'll see here. And then Lisa Clemens, the mastermind behind it all. Let her introduce herself.
My name is Lisa Clemens. I am clinically trained as a physician assistant. I work clinically in the emergency departments throughout Parkview Health, and then also part-time in a non-clinical role here at the Mirro Center, doing primarily simulation-based education for our clinicians here, and some innovation work, which is what we're going to share with you today. So I'm really excited. Thank you all for being here to kind of share what we have, and we hope it's something that can potentially make a difference. Erin alluded to, sleep-related deaths unfortunately impact a lot of people, and I know from an emergency department standpoint that spans obviously the infant, the parents, siblings, and our healthcare workers as well. They're very tough situations for everyone involved, and if there's anything that we can do to help, we're definitely invested in and eager to do that. So share with you kind of our journey that we've been on here. Maybe I'm gonna let you go ahead and there we go. So when we first kind of started out on this journey, we examined the literature, met with Erin's team probably more times than they ever wanted to meet with us, but they were fantastic. Found a lot of sightings of safety misconceptions, cultural beliefs as reasons that caregivers were citing they were not following safe sleep recommendations. So I know a lot of people have seen this graph. I particularly like it. It's from the CDC. So you see that nice dip in overall SUID there in purple from about 94 to 99. That's when we saw implementation of Safe to Sleep, Back to Sleep program. And then we have little ups and downs, but fairly stagnant. We're not seeing huge gains as we've continued since then. And we really haven't seen much change in the way of recommendations. The AAP has been promoting back to sleep for quite some time. The question is, why are we not continuing to improve? And if the recommendations haven't changed, could it potentially be something in our delivery? Why are we not reaching caregivers, family members, and seeing that behavioral change? We built this education toolkit on the health belief model, just to give you a little bit of a framework, what we worked off of. These are some key concepts. I like to equate this to the Don't Text and Drive campaign. So we have that, it's pretty prevalent here in Indiana. And with that campaign, we're saying if you send a text message while driving, you are putting yourself at increased risk or susceptibility to get into a car accident, and then the poor outcomes associated with that, brain damage, death, paralysis, etc. We are not saying that every person who sends a text message while driving automatically gets into a car accident and dies. That's not true. But we're saying if you continue to text while driving, every time you do that, you are putting yourself at increased risk. This is similar to kind of the conversation we're trying to have with Safe Sleep. We have grandma who says, I've slept all of my kids in bed with me, on their stomach, whatever it is, and they turned out fine. So when I watch my grandchild, I'm going to do the same thing. Or even a parent that says, I've done this with all of my previous infants, they turned out okay, I'm going to keep doing it. When we think about this in this framework, we know that unsafe sleep practices put our infants at increased risk for sleep-related death. And just because an infant in the past has been okay, doesn't mean the next time that we continue to use those unsafe sleep practices that they're not at risk. Similar to Don't Text and Drive. It may be the next time that you're texting while driving that you get into the car accident, similarly with Safe Sleep. So just to kind of give you a little bit of a background, what health education model we used when we built this. We originally, I laugh every time I do this. This is where we started with this. We had this idea that we were going to use our really expensive simulation equipment and we were going to go to baby fairs. And we wanted to leverage those concepts that we use when we train our healthcare providers, experiential learning, appealing to auditory and visual learners. And when we deliver the safe sleep education, we wanted to incorporate all of those aspects. So we were going to take these high fidelity mannequins, which they can cost $50,000 to $75,000 for one of them. They do lots of cool things, but not super accessible to the general public. And then this simulation software that you see here, and show demonstrations of different sleep positions. We had a swing, we had a car seat to demonstrate upright sleeping, and we were going to show the associated oxygen saturation level simulated, and then talk about why those different sleep positions potentially put infants at risk. So we were registered for this baby fair, and then COVID happened, so everything got canceled. And then we kind of had to pivot how can we do the same thing and potentially reach more people, especially in the era of COVID, because large events like this aren't happening. So we decided to come up with a way to still provide this education, but in a way that's more accessible to the general safe sleep educator and didn't require all of this expensive simulation equipment. In talking with Erin's team, we also learned that the vomiting while sleeping misconception was pretty prevalent in our area, and our educators were struggling with conveying why back is still best in an infant who vomits or has a history of reflux. So they kind of talked with us, how can we make this more hands-on? How can we really drive home this point? So John pulled a CT scan. So this was an adult CT scan for our first prototype, and 3D printed. You have oropharynx, so back of the throat. This one actually had a tongue originally, esophagus in the back, stomach there at the bottom, and then in the front, we had the trachea and then 2 main stem bronchi. We didn't have lungs originally, but we filled it with fluid for proof of concept and just kind of showed if an infant spits up on their back, because of our anatomy and gravity, it's actually most likely to go back down the esophagus and into the stomach, versus if they're on their stomach and they spit up or vomit. Now we have the airway on the bottom, so anatomy and gravity, some will come out of the mouth, but we run that risk of some of that fluid going down the airway into the lungs. And then our educators can talk about aspiration pneumonia, hypoxia, sleep-related death, etc. So we thought this was really great, this really anatomic model. And then Erin's team, as they're so good at, kind of brought us back to reality and said, hey guys, like the general public, they're going to be like, this looks nothing like a baby. What are you talking about? So they felt like it would be easy to dissociate this very anatomic model with an infant. So this is kind of where we landed. We shrunk that airway model down, simplified it a bit, added lungs on, filled it with a different color fluid that kind of stood out a bit better. And then we inset that into a silicone infant. So the infant weighs almost 4 pounds, soft, pliable material, just to really kind of enhance that fidelity. This isn't going to feel like a hollow baby doll. When we're talking about this, this is going to feel like an infant. And we kind of bridge the line between, John says, realism and freaking people out. So that's what we tried to do. But so we have that component. And then we also have the mobile application, which you see here. We had a very simplified version for proof of concept that we used throughout our pilot program. And this is kind of the, I like to say, a little bit prettier version. So just reskin version functions the same way. And typically these are meant to be used in conjunction. The infant model would, again, like what we were originally planning, be placed in different sleep positions. The educator would select that position on the app. And then we simplified, we got rid of that pleth that you saw with the oxygen saturation on our simulation equipment. That was a request from Erin's team so that we weren't going to confuse caregivers. We made it green, good background, red for bad background, and then changed the numbers, as well as a hospital-like alarm tone for those unsafe sleep positions to really hit our visual learners, auditory learners, and then we're kind of engaging them in the experiential learning. They can hold the infant, they can move it around and see how it works. They can select those buttons on the app, in the hopes that now, instead of a stand and deliver, do this because I'm Lisa and I'm a PA and I'm telling you this is what you should do when you sleep your infant, to we're going to talk about it. We're going to talk about why these are safe, why on back is safe, and why everything else is not. And that, the goal is that we're going to open the door for those conversations for caregivers to express, what are the barriers to actually utilizing these safe sleep practices, because we all know the the majority of the general public just says, yep, I'm going to do that. And, they don't want to tell us that they fully intend to co-sleep, or that they are co-sleeping, or, what unsafe sleep practice they're following. They kind of nod along, and part of that, I think, on us as educators, in the current stand and deliver method, or here's a handout method, we don't really encourage that a whole lot. So just again, our goal here is just potentially giving a different avenue to change up that delivery of the education. Recommendations are still all the same from the AAP, just giving you another tool in your toolkit. So I'm going to turn it over to John now to elaborate on the kit itself.
Right. Thanks, Lisa. I never get tired of hearing that awesome journey we've been on for the past 2 years now. Going through the innovation competition and getting feedback and really helping out, taking it from that first airway model with the tongue, and it was very anatomical, and transforming it kind of where it is today, getting such positive feedback on it. So I'll talk a little bit about the more technical aspects of it, and give you, one of the better virtual demonstrations that we can with this kit. This thing really leverages those experiential learning concepts, making this hands-on, and as Lisa said, transforming it from the traditional one way of, okay, this is what you need to do because I a healthcare provider, I know, like, this is just what you need to do, to that kind of conversational, like, hey, let's learn together. All right, yeah, your baby needs to sleep on their back, and here's why. Like Erin said, it comes back to the why. So I'm going to hit play here and just kind of talk over this video. We won't watch the whole thing, but this first demo is that original model here, and this really provides a great visualization of the concepts that we just kind of morphed. So we've got, I'll pause it here, that tongue right there, the mouth and the upper airway, the trachea, and then the main stem bronchi are on top, and we've got the esophagus that goes down to the stomach. So we've since refined that, made it more user-friendly. I'll also be talking about some of the iterations that we've made and future changes, because we want to continue to develop this and make it as beneficial for as many people as possible, and adapt it to the various populations that we have to educate about safe sleep. So, sorry, I was yakking a little bit. You can see when the baby is on their back and they vomit, just due to our anatomy and gravity, it's got a higher chance of draining back down the esophagus. But when they're on their side or on their stomach, well, now that trachea is on the bottom. So yes, some will come out of the mouth when they vomit, but now there's a higher chance for it to drain down into that trachea. And it's a great segue into all those dangers of aspiration pneumonia, ICU stays, and potential brain damage and even death. So I'm going to jump forward. So this is kind of where we landed after gathering feedback. It's a silicone baby. The baby itself, it's really durable. So that part of this kit, you don't have to worry about it being too fragile. That baby can withstand daily use. It can all be cleaned with just warm soap and water. And stand up to the quick sanitizing wipes too. Like with our community health workers, they go through and they see several patients in a day. So we made it to be as durable as possible. The inside there, that material is a little more fragile, so you do have to be a little more delicate with it. But you can see we added lungs. We kind of simplified it a little bit. We love doing this demonstration when it's inset within the baby, because then that can really give context to people who may not know the anatomy when you pull it out of the model like that. So that is the Safe Sleep infant, and I'm going to skip ahead. There we go. So that's part one of the kit, and one exciting change that we've made, and we'll have to get a good video of this in action here one of these days. But you can see here, there are two slots here. You can just ignore this back one because this is a pretty new one. This is the prototype where we were kind of just proof of concepting things. But this front one, right where that trachea is, so that's the actual size of about a 36-week gestation infant's trachea. And this really provides a a hands-on demonstration about positional asphyxiation when you kind of bring that chin to the chest, like what happens when they're sleeping in a rocker or a car seat that's outside of the car. Yeah, they may look so cute and comfy and you don't want to wake them up, but look what can happen inside of their body. That can start to pinch off and now they're not getting the oxygen that they need. So that's just one great example of the changes we've made just within the last 6 months on this one, and that we aim to keep making changes like that based on feedback of end users. So this infant is very hands-on, and it's made to be used in conjunction with the Safe Sleep application. So this is the first version that we made. It functions exactly the same as that, the light blue and the orange and the white version that Lisa showed a couple slides ago. This is just a great video to show the capabilities of it and function. So it doesn't talk to the baby yet, at least, but now it's designed to be used in conjunction with it. So our Safe Sleep infant, we can set this if we're in the one-on-one setting in the home. We can put it, throughout the house, put it in the pack and play, and say, okay, when your baby's on their back, this is what their O2 saturation looks like, and this is what it should be. This position is going to give your baby the best chance of it being good as it should, as close to 100 as possible. And this leverages visual and auditory cues. You see that background's green, and 100% is what we want. And then we can tailor this to various clients. And so we're making a couple of changes to accommodate that. But you can see on back is the only safe sleep position, of course. These other 7 are all just unsafe sleep positions. And so in Fort Wayne, for example, we have a large Burmese population who uses sleeping hammocks. It's just a cultural thing that they do. So we added that button in here so that we can really connect with those caregivers. So we can then take the infant, and I'll stop on hammock. We could place it in the hammock and say, okay, now go ahead and hit the hammock button, and really show them, okay, so your baby may be sleeping just fine initially, but if they kind of roll over or turn their head, or if the fabric folds over their face, we can hit that hammock button, and now we have that lower O2 level. I'm not sure if you could hear the kind of hospital-esque alarm that goes off, the background changes to red. Once again, really trying to hammer in on those auditory and visual cues for those kind of learners that, oh gosh, okay, this is what can really happen. We're not just saying it to say it. There are real dangers associated with these unsafe sleep positions. So these aren't taken from any study, because there hasn't been any study that detects O2 levels in infants in deliberate unsafe sleep positions. So these are all just, kind of those examples of those worst case scenarios. This is what can happen in those never moments. I'll talk about a few of the changes we're going to be integrating. So we're going to make the O2 level more dynamic so that it's kind of live. It's going to start off at that 100%. And then as we go through these positions, it's going to dip, and change. Not just as a quick static change from 100 to 75, it's going to drop down as you continue to talk about it. We're going to make these adaptable and give options so that, if you only use a handful of these, that's all that's going to appear. Or if there's a specific position that comes up a lot in your population, like with the hammock here in Fort Wayne, you can easily just kind of write that in. We've gotten some feedback from pediatricians locally and on the East Coast that like these changes. They also asked us to integrate risk factors too. So things like smoking or illicit drug use, adding blankets separately. We're going to add that feature into it so that will kind of compound and make the saturation drop lower and faster to really illustrate to people the dangers of those unsafe sleep conditions. So currently, this is an educator-facing toolkit. So these are meant to be used by anybody who is providing this education to caregivers. We plan in the future to also release, as we continue to iterate this and make this better and better, we're going to add a few extra features to the educator side, but eventually have a client-facing application. That way you can do the education and have them scan a QR code or go to this website and they can download it and have it on hand. And that way, when you're not around, if they're talking about safe sleep, they have resources and share it with other people. It's a complex issue, and it's really going to require a cultural change around safe sleep for us to see that next dip in that initial CDC graph that we saw. So we're trying to tackle it from every angle that we can. So those are the two parts of the kit there in action. Oops. Go back. I'll just touch on the pilot plan that we're doing here locally. We're opening up for questions, and then we'll wrap it up with the giveaway. So we are in the midst of a small program evaluation here locally with the Parkview's Women's and Children's outreach team and a local organization called Healthier Moms and Babies. And they've both focused on the higher risk populations in our area and dealing with safe sleep. Their typical MO has been one-on-one learning. They go into the home and they meet people where they are and they help them out as much as possible. And safe sleep is a big topic. So this pilot plan is still ongoing. COVID has thrown a couple of big wrenches in it. So we're hoping to wrap up the data collection by March at the latest, and then do a write-up towards the second half of next year. So as we gather data from that, oops, stay there. We're also, our eyes have just really been opened over this past 2 years. We started off after the innovation competition with this pilot program, thinking, okay, community health workers, hospital staff, PEDS offices, OB's offices, that's where we can really leverage this. But since we've had more and more meetings and people that have heard about this have been interested. So if you have any ideas or anything, definitely post it in the chat or reach out to us, because we've since met with Allen County's DCS department. They have just a handful of kits. Dose training, like I mentioned with Mike Sharp, direct on-scene education, EMS providers, there's opportunities there. We had Erin talk a little bit about, we're really looking at, it's not just a multifaceted issue, but it's a multi-generational issue too. So we have grandparents who were told, oh, prone or side sleeping is great. Those were the recommendations. So we've got to touch them, current caregivers, and then future caregivers. So Erin mentioned we're working at getting this integrated into school curriculum at a couple of different levels. Of course, the community health workers, labor and delivery departments, hospitals, birthing centers. One exciting thing that we're continuing to explore is in childcare. So licensed and unlicensed childcare centers that they're licensed, they have to give some component of safe sleep education, so hitting them, but then also more importantly, those unlicensed health or caregivers, that aren't required to do those things. We're figuring out the best way to reach those people. So it's just been exciting this past year, especially, and then this future where we're collaborating with all of these different entities, bringing various people together from our Fort Wayne community to really start kind of this Safe Sleep City effort and changing the culture around safe sleep. So like Erin said before, it's just the norm. Everybody knows about it. Oh, safe sleep. Oh, you're bringing your baby over? Okay, don't worry. We've got a pack and play. You're set for your sleep environment. So yeah, that wraps it up. Lisa, did you have anything else, or we want to open it for questions?
I think questions. I think there is a question on the.
All right. So we have, I see co-sleeping is on the app. Is that room sharing or bed sharing specifically? I hear parents using co-sleeping to define both of those. Yeah, great question. Right now it encompasses everything, but we're going to work to kind of delineate and specify each of those so that they know that those are specifically included in the unsafe sleep conditions.
Yeah, and that's a great point. You know, obviously, we don't want the infant in the bed with the parent, and so we had been using that co-sleeping button to mean in the adult bed with the parent. After talking with educators, we found out, you know, potentially what would be better is to have an adult bed button, and then okay, now we're going to add another person in the adult bed. And again, I know John mentioned those buttons can easily be tweaked. We actually just met with the developer this week and said, you know, we want this to be applicable to each community so that they can make those buttons say what they need them to say to reach their caregivers. So that is a feature. We anticipate you will have your 8 buttons, and you know, in your particular location will be able to set what those buttons say. We'll obviously have presets, but that's a great point. You know, the terminology used in different areas is different. We also sometimes use that co-sleeping button when we talk about you're sitting on the couch or in a chair, everybody's tired, baby's sleeping on you, and now they slide down and they become wedged. So changing kind of that button so it's more specific to that particular scenario could be helpful too. So yes, great question.
Yeah, thank you for that. That was Lauren Majors. That we want to be able to connect, you know, with the people that we're educating. And I'm glad you brought that up, because, you know, this is a great example is, you know, in Northern Indiana, there's an area where, you know, people are really advocating for co-sleeping and skin to skin and things like that. So other people are seeing boppy pillows a lot. So anything like that, you know, we're definitely trying to integrate that into the development so that you can kind of customize it to fit your program, your organization as best as possible. All right, I think that's all the questions from the chat. Doesn't look like there are any in the Q&A. Well, thank you for that question. We just want to, you know, say a big thank you for everybody for showing up and listening to us talk here for about an hour, kind of sharing this. You can get a hold of Lisa and I. Honestly, probably the easiest way to just go to safesleepsimulation.com. If you have any follow-up questions, there's a contact us page. And we'd be happy to collaborate with you to discuss things, anything that you want to talk about. Thank you, Ethel, for posting that in the chat. All right, here's just our reference slide, and now I'm gonna stop sharing my screen for a second. And now it's time for the fun part, the kit giveaway. Just give me 30-ish seconds. We just want to confirm that our list is lined up, must be present to win, all of that fun stuff. So give me just 1 second. All right, sorry about that. We're trying something new that we just found out about this morning that Lisa and I think is pretty cool. So let me just share my screen. We're gonna do this live with Wheel of Names. All right, so we've entered in everybody's name. that is in the attendee list today. So we're going to go ahead and click to spin this. It'll pick a winner, and then we'll follow up with you offline. All right, here we go. Oh, all right. Congratulations, Kelly. Awesome, that was so close. Sorry, Brittany. All right, well, Kelly, we will get your information and we will follow up with you offline, get the details figured out to get you your kit. So with that, that wraps up our first Safe Sleep Innovation webinar. Just want to give a big thank you to everybody who tuned in, and just stay tuned. We'll hope to do another one of these in the near future, get Mike Sharp back on here. Just thanks again. Looks like Kelly, if you can drop your email in the chat, just to make sure that we get the right contact information for you, that would be really helpful. All right. Well, thank you, everybody. Stay safe and healthy this holiday season. Take care.